Hi everyone, our subject today is excessive sweating, hyperhidrosis in pediatrics. Clinical overview. Physiologic sweating is a vital process for hypothalamic controlled thermoregulation. There is also emotional sweating regulated by the limbic system. The human body has about 4 million sweat glands. 75% are eccrine. Eccrine sweat gland found all over the skin surface cool the body by evaporation of sweat. Apocrine sweat gland become active during puberty and are mainly present in the axilla, anogenital skin, and mammary area and produce viscous fluid to give the body distinctive odor. Excessive perspiration, hyperhidrosis, is due to overactive sweat gland as a result of dysregulation of the neural sympathetic control of the eccrine sweat gland. It can be generalized or localized to a certain part of the body, such as palms, axilla, or soles. It can also be primarily, usually idiopathic, or secondary, caused by an underlying condition like hyperthyroidism. Excessive sweating is a common problem and can be distressing, leading to embarrassment and avoidance of social contact. This is simple differentiation between common causes of excessive sweating. Fever could be generalized, profuse, patient may be ill-looking. Emotional or anxiety, there is possible profuse or associated with pallor. Drugs can be generalized with possible profuse and possible ill-looking. Idiopathic, generalized and profuse. Obesity, possibility of profuse and related to movement. Recommended investigation. The vast majority of cases with hyperhidrosis do not require any investigation as the cause is obvious. Blood for thyroid function test, blood glucose to confirm hyperthyroidism or hypoglycemia. Hyperhidrosis severity scale to monitor progress after initiation treatment. Brain and cervical MRI in cases of suspected chair malformation. Top tips. Palmar hyperhidrosis has a prevalence of up to 3% of the population. In situations with fever, anxiety, and stress, there will be worsening symptoms. In children with acute hyperhidrosis, febrile illness is by far the most common cause. In cases of generalized sweating, every effort should be made to find an underlying systemic cause like hyperthyroidism or hypoglycemia and treat it. In excessive sweating of the palms and soles, aluminum hydrochloride as a 20% solution is often helpful. The low social esteem and social isolation experienced by some patients with hyperhidrosis may be compounded by the malodorous bromohidrosis and fetid odor caused by decomposition of sweat by bacteria and yeast. Red flag. Be aware that in severe cases of sweating, the skin, especially on the feet, may be macerated, fissured, and scaling. This can be mistakenly diagnosed as a primary infection, such as fungal infection, rather than sweating as the primary cause. Increased hydration may contribute to pyogenic infection and contact dermatitis. Episodic sweating, particularly if associated with the abdominal symptom, diarrhea, vomiting, or pain, could have carcinoid syndrome or pheochromocytoma as an underlying cause. Sweating with mild or without obvious fever can be due to tuberculosis, brucellosis, or lymphoma. Urgent attention should be given to sweating occurring in sleep or associated with weight loss. Possible diagnosis in infant, common causes, warm environment, infection, drugs like antibiotics, warm dressed, excessive crying, rare causes like heart failure. Possible diagnosis in children: common fever, face of deafness, emotional anxiety, drugs, antibiotic, opioid, fluoxetine, idiopathic, obesity. Rare causes in children: endocrine, hyperthyroidism, pheochromocytoma, rickets, spinal injury, heart failure, hypoglycemia, familial dysautonomia, malignancy like lymphoma, tuberculosis, withdrawal from narcotic, opioids, carcinoid syndrome, Chiari malformation with syringomyelia, Chidak-Higashi syndrome.